Bob Seeley.
Thank you very much indeed, Madam Chairman. I will make my points as briefly as possible, and thank you for calling me. I thank my right honourable friend for this debate. I think it's an overlooked but an exceptionally important subject. I'm going to talk briefly about my island's relationship with arts and its wider purpose, some fantastic examples of art and healthcare, or the use of art in healthcare on the island, and then also very briefly about the Arts Council England's visit to the Isle of Wight on the 20th of October, which we are looking forward to reinforce our reputation as Britain's arts island and to seek a stronger relationship with national institutions. And I look forward very much to government support in enabling this. And I thank the Minister for being here. On the island, we have a unique relationship with art, and our history in some senses is an example of art's meditative and restorative roles. From 1790 onwards, when chaos and revolution in Europe made travel difficult, artists and writers began to explore the United Kingdom more, and they came to the island in part to find a sense of peace and to be inspired by our sort of rural tranquility, but also our inspiring nature and the sea. And the island provided inspiration for artists. So Turner's first great work was of the Solent with the needles at its backdrop. Tennyson moved to the island, as I say, to be inspired about it. And in some of his work, you have a very meditative sense and calming sense of his view of life and death. So perhaps the most famous poem that he wrote was called Crossing the Bar. And physically, it described the crossing from the Solent, across the Solent from the mainland to the island. But metaphysically, it talked about the journey from life to afterlife. Sunset and evening star and one clear call for me. And may there be no moaning of the bar when I put out to sea. And I use that quote because art is used on the island in palliative care, in youth mental care, and in the NHS. So in Newport, in our county town, our wonderful hospice uses art to help islanders who are dying understand and accept difficult and profound issues. Our hospice director, Nigel Hartley, trained as a pianist and psychologist prior to working in the hospice movement. He is an interesting person if you ever have the chance to talk to him, if the Minister ever has a chance to talk to him. He champions the use of art in healthcare, and we have a wonderful project with the Royal Academy whereby artists and people in the hospice work together to create works of art, and we're lucky to have people like Nigel on our island. Elsewhere, in our Key Arts project, run by the multi-talented Paul Armfield, we have a Waves programme that engages over 200 young people. Many of them reported to us, or they come through the young carers or the mental health services, and they are engaged in the use of art to enable them to express themselves in a more fulfilling way.